Never mind. Hello, everyone, and welcome back to another episode of Mind Matters. Today we're here with Mr. Rob Novick. Um, this is a podcast where we explore mental health, emotional well-being, and I'm Neil Suchdave, and today we're joined by a dedicated social worker. Would you like to introduce yourself and kind of tell everybody what you take part in?
Sure. Yeah, my name is Rob Novick. I'm a licensed clinical social worker and been in private practice now um, for over 10 years. But I've been working in the field of mental health and even more specifically, probably even severe mental illness for over 25 years. Working with individuals with schizophrenia, bipolar disorder, major depressive disorder, anxiety, and things like that.
That's great. Thank you so much for being here with us. To start us off, I'd love to know what inspired you to become a social worker.
I knew actually back when I was in college, I initially was um, looking to actually go to veterinary school.
Oh,
Um, and so I was taking some of those classes that are required similar to like you would take for medical school, actually. And I just noticed back when I was a freshman, sophomore in in college, that people would just talk to me about their problems. They would just open up, and even without me really even asking. And I had the thought of I should probably get paid for this. And and I did take my intro to psychology class freshman year in college, and I liked it. It wasn't great. And then a friend of mine actually convinced me to take a psychology class with him because he was going to pursue psychology. And I think the class was called Perception, which is more on how uh, humans perceive um, the environment from from your eyesight, your hearing, and what's going on with all of that. And that just really intrigued me. And then I took an abnormal psychology class, and I think some colleges may call it psychopathology.
hmm.
And I absolutely loved it. And I said, "This is what I've got to do." And I just asked around to find out if I should pursue getting my PhD in psychology, what route I should go. And I decided from just talking to different professors and professionals in the community to pursue the social work path. And
Wow.
so I decided to get my master's in social work for a variety of reasons. One is I can get to where I am now quicker
Hmm.
because it's only a 2-year program to get my master's, and then a couple of years back then, it was 3 years of additional supervision postgraduate graduate school, and then I can be out on my own.
Mm.
Whereas with you're getting a PhD, you have about 2 years of coursework, dissertation, defense, a lot more student um, uh, financial aid or student loans. So it was a quicker path to get to where I am now.
So would you say it was that psychopathology class that kind of got you going from the veterinary side of healthcare to mental health?
Um, yeah, it was. I would say it was probably the perception class that kind of
Okay.
really um, piqued my interest with kind of going that path, but really diving deep into the abnormal psych and learning about schizophrenia and what's called the DSM, the book of all of the list of all of the mental illnesses.
Mm.
Um, Really, it's like, wow, this is fascinating, and so that's kind of where I decided to pursue that avenue.
Okay. Going on to current instead of the school leading up to it. So, what exactly does like a typical day look for you?
Um, Majority of my day is made up of seeing clients who I've been seeing ongoingly. Some of them can be I see once a week, could be once every couple of weeks. I do have some clients who I see once a month, once every 2 months. It just depends on what their needs are. Today, I had a new individual start. Never met him before today. And so it's just, I when I look at my calendar, see who my clients are, who I'm seeing, and that's the other thing is I refer to the people I see as clients, not patients.
Hmm.
Um, and I just think it's just more of a personable type approach of referring to people as a client. Um, and so I'll just kind of do a little bit of I'll look at my notes from uh, my last session or two with them. And so that way, going into that actual session with the person, I will be able to kind of follow up with some of the stuff that we had talked about, as well as, um, homework assignments that I may have recommended to the client to work on until the next time we were seeing each other. And then also just kind of get caught up with how things have been going since the last time
Hmm.
uh, I talked to them. And so, yeah, that's really what it comes down to is just kind of getting a updated information and try to build on what they may have worked on previously.
Okay. So you said today you had a new patient come in. So how does the first evaluation of a new client contrast to a recurring client that you have?
Okay. So, um, obviously, I'm going to know very little about the person until I start asking questions. Obviously, when the person does call me up initially, I will kind of get a little bit of information over the phone just to make sure that I'm the right person for them. If there's a parent who's calling because they want me to see their child, I
Hmm.
I, I don't see children, so I kind of have to weed that out. But if somebody has like PTSD or um, eating disorders or things like that, I don't treat that. So I
Oh.
just kind of screen, if you will, kind of what's going on with the person to see if I'm even the right person for them. And then when they're actually in my office is um, I'll try to remember what it was that they had told me over the phone. And then I'll just start asking. I've got a whole psychiatric evaluation that I will start asking questions, kind of what brought you in, what we call your presenting problem. Get some history. Start talking about depression or anxiety. Tell me about your symptoms. How long have you been having these symptoms? Is there a history of these symptoms? Has a person ever been diagnosed, or it maybe they haven't been diagnosed, but if they've ever had like a manic episode, getting an idea of what their background is, um, and um, and then just moving on from there, as well as family history, um, and drug history, abuse, things like that.
So all of those are kind of signs that you would see for them to be your patient. Like you said that you don't treat people with PTSD or eating disorders. So like would you refer those patients to like another licensed doctor
Yeah,
or
exactly.
um,
Yeah, I would just if I knew somebody, a clinician or a professional who does treat whatever it is that they're letting me know that they have, or what
mhm.
they're living with, then I will definitely refer them out
Okay.
because I'd be doing them a disservice if I was seeing them and I'm not the right person for them.
So how do you know who's the right person for you?
Um, well, if they come with a history of either a mental illness, or just a symptoms that I have a history of working with and a
Hmm.
comfort level, and I would even have to go as far as say confidence in working with that those issues, then I will absolutely continue to see them. If there's some similarities, maybe to some other things that I've seen in the past that maybe I haven't seen exactly, then I'll continue to see that person. But
Okay.
if there was actually I have a client years ago who I was treating, and she had schizophrenia, but she also had an underlying eating disorder, and so it became apparent that the eating disorder was more of a problem than her schizophrenia at that time.
Hmm.
So I referred her to a therapist who specialized in eating disorders. But then I was also around and available for the other therapists who, she needed assistance with her schizophrenia symptoms.
Okay. So kind of like some problems that trump over the other problems causes you to kind of move them over to other people who specialize in those problems.
Correct, as including a psychiatrist, because maybe based on my assessment of what's going on, they need some medication, and so I
Okay.
want them to be evaluated by a psychiatrist.
Okay. Um, uh, so what do you think are the most challenging aspects of what you do?
Um, Making sure that a person is when they're talking or providing information that it is accurate and truthful, um, and also making sure that there is a aspect of where there's rapport and I'm providing a safe environment for the person to disclose, some pretty um, confidential or sensitive personal information.
Mm.
And so just making sure that I'm providing that type of an environment for my clients, because if they don't feel like they can disclose information, then we're probably not going to get very far.
So, okay, yeah, I remember during the presentation you said to kind of get them into that environment, you would like maybe even like during the movie that we watched, you said that the psychiatrist would like get on his knees or kind of use hand gestures and look at them kind of like in their eyes to create a safe space. So like what are like all the aspects that you do so that your client feels like they can share whatever they need to share?
Um, I mean, it obviously each person is a little bit different as to what they might require or need to feel that sense of safety. And, in some aspects, you can call it psychological safety. Um, but it's also, by giving them the, um, the idea, and actually not even the idea, but to let them know that they have the strength to say yay or nay to things if they don't feel comfortable, letting them know if you don't want to answer this question, you don't have to answer it.
Mm,
Um, and um, but also noticing certain things, especially the people who have never seen a therapist before,
mm,
their um, comfort level, obviously, you can imagine, is pretty, frightening. Or excuse me, they're frightened, so their comfort level is pretty low. And so I sometimes will even use some humor, when like I just want to let you know I don't bite, and just kind of making sure that they know that this is just a matter of dialogue, and they can answer what they feel comfortable answering, and skip what they don't. But then obviously, as the more they come back, the more comfort they have, and some of those guards and walls will drop.
okay.
Can you share one of your insightful stories of a client?
An insightful story of a client. Can you be a little bit more specific with that question?
So I think what he means is like one like experience that you've had with a client that kind of maybe even like changed the way you think about your work.
Okay. Um, I was working at a hospital at the time, and um, I had a client who was homeless, and I felt that his need was to be living independently. Um, and I asked him what he wanted upon discharge. He's like, I want to go and live somewhere. And so I took what he said as independent living based on what my definition of independent living was. And I took that as you're living in an apartment, probably by yourself or family or a friend or whatever it is, have a job. Um, and so I took my own definition of what I thought independent was
Mm,
and tried to create that for him. Um, and when he was on board with it, he was discharged from the hospital. He ended up coming back to the hospital at some point. I don't know if it was 2 months, 6 months. I don't remember. This is going back many years ago. And he told me about it was his experience going to the apartment, and he hated it because all of his friends were back at the homeless shelter. And he actually said that his psychiatric symptoms worsened when he was in the apartment because the voices in his head from the schizophrenia were so overwhelming to him that he couldn't handle the quiet of the apartment, and he enjoyed being in the homeless shelter more because of all of the busyness and the stim or the sounds. It kind of drowned out the auditory hallucinations that he was experiencing. So what I learned from that experience with him is if somebody tells me in a counseling session when we're talking about goals or whatever toward the beginning of, when we first get started, and they say, I want to be successful, what is your definition of success? My definition of success can be very different. For you say you want to be a psychiatrist. Well, what does that mean, a successful psychiatrist? Does that mean you have your own private practice and you are seeing X number of clients a day or a week and you're making X amount of dollars and you're whatever it is? That could be very different than a person says, I want to be working in a community mental health clinic, working with people who are homeless, and helping those people would make me or help me feel successful. So understanding a person's definition of independence, success, whatever it is, happiness, it needs to be definable and in the own person's words, not what I think they might need for themselves.
Okay. Yeah, no, that's definitely a changing mentality story. Um, do you have any like other stories from perhaps like a hospital or anything that would kind of tell us what we can expect if any of us were to go into like a psychiatric hospitals? Because in clinicals, we don't have access to psychiatric hospitals. Just well, I mean, for obviously like obvious reasons, because we're below 18 and they
Right.
probably don't want us seeing that.
Right.
But if we were to see it, do you have any experiences that you'd like to share of a psychiatric hospital so we know what to kind of expect?
I could tell you that one of the things, like throughout my career, because I've worked in lots of different psych hospitals in various capacities, um, every day is different. And the patients there who are your friend one day could be the person who wants to attack you the next. I have been threatened before. Um, and then the next day, the guy was my best friend, and he was just like, "Hey, Rob, can I help you with anything?" Um, and it You're going to have people who think that they are Jesus or God, and that they have special powers. Um, I had a client who saw the and heard and felt attacked by the devil whenever his eyes were open. And he actually lived in a psych hospital pretty much from the age of 5 until he passed away in his late 40s. He lived every day for those 40 some odd years in a psych hospital because he could not function outside of a highly structured environment. And so the number of different things that you see and you experience, and I've met people who have killed in other individuals. I met a guy who had killed his parents, and he actually was let off, or he was sentenced. His punishment was to go to a forensic psych hospital, but he got off for a reason of insanity, his defense of insanity, because he was not in his right mind when he did it. And I saw him at a hospital years later, and we discharged him back home to his regular community home. Um, so you meet a lot of different individuals from a lot of different walks of life, some people who are homeless to people who have millions and millions of dollars and are severely depressed or hear voices. Um, but that's what I loved about working in a psych hospital is every day is different and you get to meet a lot of interesting individuals. And especially what's nice is the people who you don't see for years and they come back to the hospital or you working at a different hospital and they remember you and they thank you from way
Mhm.
back years. That's pretty cool when that
Yeah.
happens.
So that guy who killed his parents, um, how do you kind of how do you know that that person was insane rather than I mean like I feel like anybody could just kind of like commit homicide and then like couldn't you just kind of act like you're not in your right mind and maybe that could get you into like a mental asylum or something like that. Like how do you know for sure that they're not in their right mind, like if they're schizophrenic or like psychotic?
Mm-hmm. And to be honest with you, that's probably a question better to ask a forensic psychiatrist or psychologist because that's what they specialize in.
Okay.
Um, and or it could be one of their specialties. But there are a lot of times that they are prior to the going to trial, and this is my understanding. And again, I don't know for sure, but if a person is, let's say, arrested because they killed their parents, um, and they have their probable cause hearing, at some point they could be sentenced to a forensic unit to meet regularly with a psychiatrist, a forensic psychiatrist, to see if they can be held or what's it called, restore competency. Was the person is are they competent enough to understand the legal system and process, as well as trying to help them understand or figure out, do they really know what's right or wrong?
Hmm.
And I don't know how long that process can take. I mean, I don't know if they like, or you have 6 months to do this, or if it's a shorter period of time, or if the person over time starts to show some progress, well, then maybe if we do this a little bit longer, then maybe they will get to the point. The individual that that I was talking about, I guess through that whole process, they determined that he, um, at the time and maybe leading up to that time when he actually killed his parents, um, was just completely floridly psychotic and he did not know. There were periods of time before that he knew right from wrong and maybe even after, but based on the evidence that they had surrounding the actual incident, he was probably not in his right mind. And so
Hmm.
that's probably how he was able to successfully have the insanity defense.
Hmm.
But yeah, if you're able to find a psychiatrist or psychologist or forensic specialist, that would be a great question to ask them because
Hmm.
I really don't know.
Um, but yeah, so like people like this, and obviously like um, a lot of like death and trauma and all that. How do you not let it affect you,
Mm,
your mental health?
right. now, it's a great question, and it I think it takes a very special type of person to be able to work in psychiatry, um, because it can be very depending on what the work environment that you're in. If you're working in an inpatient psych, you are seeing people when they are at their worst,
Mm.
when they are either floridly psychotic or severely depressed or manic out of their mind. Um, and it's once you get them stable that you discharge them out to the community. And that's where the people like myself currently are really trying to see the most progress of a person, because we're seeing them regularly and working on the little details. Um, so for me, I've always had, and I'm not quite sure how, always had the ability to separate when the door closed. If I worked in a psych hospital or like today, after I saw my clients, that when I leave my office, I just leave it. And I actually got a couple of texts today from a client I've been seeing on and off now for over 10 years. She was telling me that um, her father just fell and has a severe brain bleed, and he may not make it through the night. And so trying to provide that support for her, um, but also knowing that I have a family of my own and I need to really make sure that I focus on them when I leave and do the things I need to do to take care of myself. And it's also I don't know if you what extracurricular activities you may do for yourself, if you're playing sports or band or anything of the sort, hanging out with friends, video games, making sure that people do what they need to do for self care. But yeah, that you can. It is not uncommon to have burnout. Um,
Hmm.
Compassion fatigue is a real thing.
Hmm.
And so it's vitally important that people do what they need to do to take care of themselves.
So when you got that text, would you kind of let it go until you see her, like for a professional visit, or would you respond to that text, like right away?
No, I did. I responded right away. Um, could, um, yeah, I wouldn't just let her hanging like that because
Mm.
then she's worrying about her father, but then she's also like, she obviously reached out to me because she wanted me to know it was an important enough for her to let me know. And all I did was like, hey, I'm thinking about you.
Right.
And your dad's in my thoughts and prayers, and I hope he can pull through this. Um, but obviously there isn't anything else I can do. But no, I don't leave clients hanging like that. They're letting me know because they need something at that time.
Hmm. So when people are kind of just letting you know stuff, like kind of just talking about what is going on in their life that they don't particularly um, like in those situations, there's not really anything you can do. So how do you figure out like the correct words to tell them so that they don't feel like so that they feel better about themselves?
It's interesting you say that because I saw a lady today who I've been seeing for 3.5 years, and and we were just talking about the progress that she's made, and and how different she is now from the first time she saw me.
Mm-hmm.
And I think what happens with therapy is it's not um, so much of me having the right thing to say because I can't take away the person's pain or um, difficulties. Um, but sometimes it's just a matter of letting the person talk. And she was like today, she was just talking about a lot of different things. And I don't know what psychology classes you may have taken, but she said, yeah, like today, I feel like I was just kind of rambling and just talking about a lot of different stuff. I said, yeah, it's called free association. Um, and I said, I really didn't say much, but a lot of times just having a person talk and hearing themselves is all that they need. Because a lot of times what I'm doing is I'm kind of helping them, not me giving them advice specifically, but just helping them find their own answers.
Mm-hmm.
And if I recognize like thought patterns or ways that they are living or choices that they're making, I will highlight, and that seems detrimental or counterintuitive to what they're trying to accomplish. I'll point it out to them and let them start to recognize the pitfalls that they're putting themselves into. And it's not a matter of me. Sometimes I'll give them some advice. I'll say, "Hey, you seem like you're lonely. Have you ever thought about joining a meetup group or doing things like that?" That's like me giving some advice, but for the most part, I'm letting them figure out a lot of what they need for themselves.
Yeah, I think that's very powerful that you kind of let them figure out their own problems by just listening instead of giving advice. Because
Right,
like from my own personal experience, sometimes like the advice that I try to give, it doesn't really work for everybody. So they
right.
just kind of see me as somebody who thinks they're better than themselves. So
Mm-hmm.
That's why kind of letting them figure it out themselves, I feel like would be the better alternative.
It does, and it also lets them realize that they can do this on their own. They don't long term don't need me or a therapist.
Mm,
That's the ideal goal, obviously. Um, and you don't want to foster this sense of dependence that in order for me to get through a problem, I need to talk to Rob.
right.
No, you don't need to talk to me. What are some other things that maybe you and Rob have talked about that you're able to figure out? And maybe you can use some of those same skills or strategies for another incident or issue that comes up.
Mm, right. Yeah. Well, we have 5 minutes left here, so I just wanted to say I have like a lot of respect for the work that you do, and I think it's very, very needed at this
Mm-hmm.
time. And yeah, I know it's like I think that it's really, really hard to do what you do. Um,
Mm-hmm.
but I do really respect it a lot, and I wanted to thank you for being on this podcast and
Absolutely. I
letting
think
me
it's
ask you
great what you're
questions.
doing. Yeah,
Thank you.
absolutely. I think it's great and keep plugging away. It's necessary. You know, the stigma of mental illness is
Right. Yeah.
alive and kicking, and the more of having people do like what you're doing and normalizing it
Mhm.
um, can do nothing but help. So good for you.
Thank you. But yeah, that was episode 4 of Mind Matters podcast. Thank you guys for joining us. Thank you for listening to us and Mr. Novick here, and we'll see you next time.